Welcome to the prestigious and award-winning Ocean Clinic. Situated in the heart of Marbella, there really is no better place where you can relax and feel at ease, having all your beauty and aesthetic requirements addressed and treated to the highest of standards. First off, we'll be talking to the leading doctor and owner, Dr. K, in order to find out more about the man behind the clinic that has helped so many men and women achieve their aesthetic dream.
What inspired me in the first place to open Ocean Clinic as a new concept, a concept which sets us apart from other clinics, was the idea that I had over many years the impression that aesthetic surgery was too technical. Aesthetic surgical was applying techniques we all learned while we were in our formation. But for me, over many years with experience now, I can say it's far beyond this, and this is where our slogan Beyond Beauty comes from. My training in the field of plastic surgery is for sure really wide and has been quite international, and I think it had a great influence on the way of how I see my work today and what I'm doing and what I'm able to do today. You have to understand that most plastic surgeons learn from one certain school and apply the techniques they learned from one school. I had the chance, and I'm very, very thankful about it, that I could go to many places and learn from different teachers which had all their own qualities. And I think what it made me and what has made us, my whole clinic afterwards, an open international place which really embraces everybody. So we're able to adapt to almost every patient. We're speaking 5 languages a day, and I think all the experience I had traveling made me able to do those things. The most important thing to see for every patient when he should walk into a clinic, not only my clinic, but especially into an aesthetic surgery clinic, is confidence to the doctor who's going to treat you. You have to gain this confidence first on the way of your curriculum and of everything what you do, but that's not all. At the end of the point, it's a question of sympathy, and it's a question if you connect. And I think if you don't really connect with a patient, you're not able to go through this way with him, because it's a way which is full in the beginning of uncertainty for the patient. He doesn't know what's awaiting him. There are fears involved. It's medicine, it's surgery. So what we're going to try here, and what I try every day, is instill this confidence in each single one of my patients. I am really proud of the fact that Ocean Clinic made it through the last 5 years, growing every year and employing more people every year. And I think it's a sign that our concept, the way what we did over the last 5 years, found reflections in the general public, and that the general public is embracing what we're doing.
One of the patients today is Gabriella. Gabriella, tell us what treatment you've decided on today.
A Botox.
A Botox treatment. May I ask you why?
I've been looking tired, so I went to.
And how did you find the Ocean Clinic?
I read about it in a local magazine, and then I was recommended by a good friend.
Oh, that's a brilliant reference.
I think now it's a good moment that I show you a little bit really what we're doing and how we're going to do it, okay? So the first step I'm going to do is I'm going to mark a little bit the points I need, where I need to apply Botox. Botox is not a filler, it's not a volume giver, it's a muscle relaxant. So what we want to do is we want to relax certain areas of the face, and other areas we don't want to relax. Why is that? For example, in a female patient, what we want is we want to lift up a little bit the eyebrow, okay? The position of the eyebrow depends on the pulling of the muscles which are under the eyebrow and the pulling of the muscles which are on top of the eyebrow. So I'm marking basically here underneath that I want to paralyze the muscles which are pulling down the eyebrow, but what I don't want to do is paralyzing the muscle here which is lifting the eyebrow. This is why we get this open, gowing look. So I'm going to mark now on her face a little bit. Gabriella will have a treatment of her area around the eyes. She will have a treatment of her forehead area and of the so-called glabella area. That's the area which makes the frowning here. You can see quite good how the muscle does what my fingers does in the moment. If I relax the muscles, the wrinkles relax.
What about the risk of the so-called frozen face?
That's it. You have to adapt the dose evidently to each individual patient.
Is that the key?
That's the only key for it. You can't do too much and you can do too less, because when you do too less, the effect is very soft and not enough. Some people like this as well, it's good, but normally people want to see an effect and want to see that their mimic lines are visibly reduced.
So Gabriella, how was the treatment for you? Was it painful?
No, it wasn't painful at all.
Did you feel any discomfort?
No.
So I guess the ice pack must have helped.
Yes, it has a big help.
How was your experience at the clinic today?
I found it very good, thank you. Fantastic.
And would you recommend the clinic to family or friends?
Yes, definitely.
Dr. K, your latest invention is called the PAVE lift. Now that sounds exciting. Do tell us what it's all about.
PAVE lift, the acronym means Peeling Assisted Volume Enhancing Lift. That means, to the pure mere technical aspect of doing a facelift, performing a facelift, I'm adding within the same surgical session a transfer of soft tissue, which is mostly your own body fat. This is a volume enhancing. And I'm doing a treatment of the vector skin itself, the uppermost layer of your skin, which very often shows sign of aging.
Would you like to demonstrate?
When you look at yourself in the morning, you will see, when you look and you maybe feel tired or you feel age away, this is not only that your skin is saggy. You will look at your skin and you will see, like for example here, in the mid area of your face, the T area, you have large pores, you have little sun damage wrinkles, you have this kind of a little plastery effect, which we get from sun and we get from normal aging of the dermis, which cannot be corrected through only a surgical lift.
Oh, I see.
And if we pull skin, old skin which looks old, it will be tight skin, but it will still look old.
Yeah, that does
make
make
sense.
sense.
That's the point. And the same thing is when we have a face where the volumes that get lost. That means, for example, things like here, the jowls down here, the largely visible nasogenian lines. When this all over the age drops down and I'm just basically tightening the skin, your face will still don't go back to look juvenile, because a juvenile face is triangular. A juvenile face has a lot of volume here in the cheeks and no volume on the jawline. And when this volume gets lost through dynamic, through gravity, and this volume, the fat goes downwards, we need to address it. We can't just only reposition the skin. We need to re-enhance as well the facial volumes. And this is what I do. If the fat is really lost, because some people when they get older, they lose the fat, I take this fat from somewhere else in your body, I process the fat, and then I can use this fat to sculpt, to really re-sculpt your facial features like they were 20 years ago. And once this is finished, I will add a peeling to repair the skin which lies on top of it, which is basically a three-layered or a three-dimensional repair process of the skin.
It is your invention, the PAVE lift, so therefore is it an exclusive treatment to your clinic?
It is exclusive to my clinic, this is for sure, and there are in general very few people who have experience of combining those techniques in one session. This year I'm invited to quite a lot of big congresses, because basically most people of the plastic surgery world find this is an interesting concept. So I'm going to speak about it and present this to my colleagues, and I think it's something which we really all professional-wise have to think about it. That when we think about aging, we can't only think unidimensional, we have to think three-dimensional.
Dr. K, thank you very much for this explanation. We hope you've enjoyed this month's video blog and look forward to welcoming you to our next blog, when we will be introducing you to some of the clinic staff, talk about a much debated subject in our Fact or Fiction column, and speak to one of the clinic's loyal patients about how her life was changed by a facelift and recent breast augmentation. We look forward to seeing you then.